So I want to talk a little bit about HRT and risk, particularly the risk of breast cancer, which is what most women are afraid of and which puts a lot of women off taking it. There certainly are some women who are at higher risk of developing breast cancer who it may well be more risky to take it than not to. But there are a few of those. So unless you have had breast cancer yourself, in which case, unfortunately, HRT is almost certainly not safe for you, or you have a first-degree relative, so a mother or a sister who's had breast cancer at a young age, then actually your overall risk of developing breast cancer is not going to be increased significantly by taking HRT. And that's something which is difficult to understand because there is an increased risk, but it is a very small one. And in order to understand that, it's sensible to look at the risk compared to the risk of doing other things. So I'm just going to see if I can share my screen with you. Let's see if I can do that. Okay, so here you can see this is from the Women's Health Concern, which is the women-facing part of the British Menopause Society. And it's looking at 1,000 women between 50 and 59 and seeing how many of them will develop breast cancer over 5 years. So if you take 1,000 women over the next 5 years, if they're between the ages of 50 and 59, there will be 23 cases of breast cancer. If you give them HRT, that will increase that risk by an extra 4 over 5 years. If they're only taking estrogen, so if they don't have a womb, actually it reduces their risk, interestingly. If they're drinking alcohol, so I think this is a really good comparison. So a lot of us do drink 2 or more units of alcohol, maybe not every day, but certainly quite frequently. If you did that every day, your risk would increase by 5. If you smoke, your risk increases by 3. If your BMI is greater than 30, which is quite a lot of us, then your risk increases by 24. So you can see that there are a lot of lifestyle choices that we make that increase our risk of breast cancer, and HRT is really not a large risk compared to a lot of the others. The other thing to note is this down at the bottom of the page, looking at women who exercise. So if you are fit and healthy and you exercise for more than 2.5 hours a week, then your risk reduces, and it reduces by more than HRT increases it. So you can see from that actually HRT in terms of risk increase is very small. Obviously, the longer you take it for, the more your background risk increases. So as we get older, unfortunately, our risk of breast cancer goes up. And if you add HRT on top of that, it goes up a bit more. So that's something to be aware of. But you always have to balance that against the benefits of how it makes you feel and also of how it protects your bones and your heart and blood vessels. And if it makes you feel better so that you can look after yourself better in terms of exercise and diet and general well-being, then that probably explains why overall it seems to benefit our mortality.